Welcome to the Total Hip Replacement Prehabilitation class. The purpose of this class is to help you and your caregiver feel prepared for recovery after surgery and to understand the exercises and safety precautions you'll need to follow. Today we'll review the exercises you'll begin on postoperative day 2 before you start outpatient physical therapy, how to properly use and adjust a walker, and what to expect when getting home after surgery. Before we begin, we recommend taking 15 minutes to read through your total hip replacement therapy instructions, as it contains helpful information for both before and after surgery. This guide is found under your surgeon's profile on our website at sportmed.com. Feel free to grab a pen and paper to take notes. You can also pause the video if you feel you need extra time to review or practice. Let's get started. Post-operative exercises starting day 2 after surgery. These exercises are designed to help improve circulation, maintain muscle strength, and support a safe recovery. Always perform them on a bed or firm surface, and please do not exercise on the floor. Surgery day is considered day 1. The exercises we're about to review begin on day 2. Unless otherwise noted, all exercises should be performed 2 to 3 times per day. Supine quadriceps sets. Lie on your back on a bed with your legs straight and toes pointed toward the ceiling. Tighten the muscles on the front of your thigh by pressing the back of your knee down into the bed. Hold for 10 seconds. Repeat 10 times. Pro tip, make sure to keep your toes pointed toward the ceiling during the exercises. Try to flatten the back of your knee toward the bed. Supine ankle pumps. While lying flat with your legs straight, point your toes downward for 3 seconds, then pull them back toward you for 3 seconds. Repeat 30 times. Pro tip, try to keep the rest of your legs relaxed while you move your ankles. Seated knee extension active range of motion. Begin sitting upright on the edge of a bed or flat surface with both legs hanging off the edge. Tightening the muscles in your thigh, slowly lift your foot to straighten your leg. Then return to the starting position and repeat. Hold for 3 seconds. Repeat 10 times. Pro tip, make sure to keep your movement slow and controlled. Standing knee flexion. Begin in a standing, upright position in front of a counter or stable surface for support. Slowly bend your knee, lifting the foot off the ground. Hold briefly, then return to the starting position and repeat. Repeat 10 times. Pro tip, make sure to maintain an upright posture and keep your movement slow and controlled. Glute sets. Begin lying on your back in bed with your legs extended. Tighten and squeeze your buttock muscles. Hold for 5 seconds. Relax, then repeat 20 times. Supine heel slides. Remain lying on your back with both legs extended. Slowly slide the heel of your surgical leg toward your buttocks, bending the knee. Then slide the heel back down to the starting position. Do not lift the heel off the bed. It should remain in contact with the surface the entire time. Repeat 10 times. Continue these exercises until your first outpatient physical therapy visit, where your therapist will reassess and provide an updated home exercise program. Hip precautions. Some surgeons require patients to follow 3 specific hip precautions for a time after surgery. These rules may help reduce the risk of hip dislocation. If your surgeon has prescribed these precautions, it's important to follow them carefully. Hip precaution number 1. Do not bend your hip past 90 degrees. This means you should avoid closing the angle at your hip too much. For example, do not bend forward to put on socks or tie your shoes. When sitting in a chair, lean back slightly to keep the front of your hip open. If you drop something on the floor, extend your surgical leg backward. Keep your hip open and bend through your non-surgical side to retrieve the item. This positioning keeps the hip joint in a safe, open position. Hip precaution number 2. Do not cross your legs or let your knee cross midline. Imagine a straight line running down the center of your body. Your surgical knee should not cross that line. Crossing ankles while seated is generally okay. Crossing legs at the knee is not allowed, as it increases the dislocation risk. Hip precaution number 3. Do not turn your toes inward. When turning your body, lead with the foot on the side you're turning toward. For example, when turning right, step first with the right foot. When turning left, step first with the left foot. This helps prevent twisting through the hip joint. Following these 3 hip precautions will significantly reduce your risk of hip dislocation. If you have any questions about whether these rules apply to you or how long you should follow them, please contact your case manager prior to surgery or discuss with your physical therapist at your first therapy appointment. Walker use and safety. In the next part of this class, we will review how to properly use a walker, including walking patterns and safety tips for getting around after surgery. When you receive your walker prior to surgery, it's important to adjust it correctly. Walker height adjustment. Stand inside your walker with your arms relaxed at your sides. The hand grips should line up with the crease of your wrist or about where you wear a watch. The hand grips are too high when the grips reach your forearms. The hand grips are too low when the grips reach your palms or fingers. Adjust all 4 legs evenly using the adjustment pegs. Then recheck the height. Once adjusted, walk through your home with the walker to ensure clear, safe pathways. Transportation on surgery day. Bring your walker with you to surgery. A mid-size SUV or sedan is ideal. Avoid high trucks or low sports cars. To stand from a chair, scoot forward, extend your surgical leg, push up from the seat with your hands. You may place one hand on the walker for balance, but do not pull on it. Walking pattern with a walker. Number 1, advance the walker. Number 2, step with the surgical leg. Number 3, step with the non-surgical leg. Repeat this pattern each step. Getting in and out of the car. To sit, back up to the seat, extend your surgical leg, reach back for the seat, lower yourself down using your arms. Your nurse or caregiver will help lift your leg into the vehicle. At home, reverse the process with assistance. Stair navigation. A helpful rule to remember is good leg goes up, bad leg goes down. Your surgical leg is strongest and least painful when kept in a neutral position. This is why it stays straight during stair use. Going upstairs, step up with the non-surgical leg, then bring up the surgical leg. Going up the stairs with a walker. Approach the stairs, then fold your walker. Place it in one hand and place the other hand on the rail. Lift the walker and set it to the side of the next step. Step up first with your non-surgical leg, then follow with your surgical leg, bringing the walker to the next step. Repeat. At the top of the stairs, unfold the walker and set it on the landing, making sure you hear the walker click into a locked position. Going downstairs. Step down with the surgical leg, then bring down the non-surgical leg. Going down the stairs with a walker. Approach the stairs, about 2 inches from the top step, then fold the walker. Place the folded walker to the side opposite the handrail with your other hand on the rail. Step down with the surgical leg, followed by the non-surgical leg. At the bottom of the stairs, unfold the walker, making sure you hear the walker click into a locked position. Place both hands on the walker and proceed with walking. We encourage the use of handrails, a walker, cane, or assistance from a caregiver as needed. Cane use. When it is time to transition to a cane, your therapist will assist you with knowing when this is appropriate, how to adjust the cane, and how to walk with the cane. In general, you should hold it on the opposite side of your surgical leg. The cane should move with the surgical leg. This improves your balance and promotes a more natural walking pattern. At-home recovery tips. Ice for up to 30 minutes every hour is needed. Expect swelling for several months, with noticeable improvement by 2 weeks. Pain may be worse at night early on. This is normal. As you recover, your energy level may be low for a while after surgery. Remember to drink plenty of water to stay hydrated. It is important to have someone with you for the first several days after surgery. Frequently asked questions. These are some of the most common questions we hear from our patients when preparing for a total hip replacement. When can I drive? Your surgeon will determine when it is safe for you to resume driving based on your procedure and recovery process. How soon do I start physical therapy? Most patients begin physical therapy 1 to 3 days after surgery, unless your surgeon provides different instructions. How long do I have to use the walker? This varies by patient and by surgical approach. Your surgeon and physical therapist will guide you based on your strength, balance, and healing. Where do I get my walker? Your case manager will assist you with obtaining a walker. When can I go back to work? Return to work timelines differ depending on your job duties and your personal recovery. Please discuss this directly with your surgeon. How much do I need to ice? Ice is an excellent way to help minimize pain and swelling. You can ice up to 30 minutes at a time. Use ice for pain relief at least 3 times daily for 15 to 20 minutes, and more is needed. Always ice after your exercise program. Never put an ice pack directly on your skin, and remember to use a barrier such as a dish towel. Ice machine questions. Your case manager can provide details about whether an ice machine is appropriate for you, how to obtain one, and what is included. Equipment questions. Please contact your case manager with any questions regarding equipment, such as TED hose, floor pedalers, front wheel walkers, canes, potty chairs, shower chairs, and knee immobilizers. Finally, do not be afraid to put weight on your surgical hip. It is designed for movement. Only significant trauma, such as a fall or car accident, would damage it. If you have questions or concerns during recovery, contact your surgeon's nurse or case manager at 423-624-2696. This information is listed in your surgical packet, along with copies of these exercises for reference. Thank you for choosing Center for Sports Medicine and Orthopaedics, and for taking the time to prepare for your surgery. We're here to support you every step of the way.